Contracted COVID-19 in the month of October alone. This is according to KMPDU officials who have expressed concerns over the second wave of COVID-19 in the country that they say could easily paralyze the health sector. Zainab Mohammed now reports.
220 days since the first case of COVID-19 was reported in the country, fear is seemingly engulfing Kenyans, with talks of the start of a second wave echoing from all over. The COVID-19 cases seemingly rising by the day since the relaxation of the containment measures last month. According to statistics from the Ministry of Health, in just 21 days, the total number of COVID-19 cases recorded in the month of October is 7,615 cases, double the total number of COVID-19 cases in the month of September that recorded 4,328 cases in 30 days. The number of deaths in the 21 days of the month of October seemingly higher than the number of deaths recorded in the whole of September, with October recording 147 deaths as compared to 134 deaths in the month of September. KMPDU officials now raising concerns in the rising numbers that could easily overwhelm the health sector, thereby paralyzing it completely. According to the officials, the second wave is already seeing a huge number of health workers contracting the virus, hence affecting their service delivery at an extremely critical time.
217 healthcare workers are so far infected in this month, against a total of 1,295. And this is attributed to several things. One is the disregard of the COVID-19 human resources for health protocols and guidelines by those in administrations at the county levels, where healthcare workers are being forced to continue working even when they have contracted COVID-19. This trend must stop.
The union now pointing a finger at the government for the relaxation of the COVID-19 containment measures, citing the relaxation and disregard of the containment measures as key factors for the stimulation of a second wave.
Would like to note with a lot of concern the rising number of COVID infections since the ease of restrictions. And what is even more worrisome is the continued disregard of the COVID-19 prevention measures by both the public and the political class. And so we urge all members of the public and the political leadership to adhere to the Ministry of Health prevention measures on COVID-19.
Elsewhere, Nakuru County has been recording a high number of COVID-19 cases in the recent past, with the county governor Lee Kinyanjui now saying 80% of the public hospitals in the area are full and will not be able to handle more patients should the surge of COVID-19 numbers continue.
Hospitali zetu ziko about 80% full, which means if the trend goes on in the next 2-3 weeks, we are talking of a situation whereby we may not be able to contain these people who are reported. So our request to all the people of Nakuru is to take the measures given by government seriously.
Zainab Mohammed, TV47.